Hi guys, welcome back to my YouTube channel. So I was going through my social media news feed yesterday and I found this really exciting piece of information. Apparently, scrub nurses and ODPs here in the UK will be urged to take a 2-year course to become surgical care practitioners. For those of you who don't know what a surgical care practitioner is, it's a trained nurse and ODP who can perform some roles that a doctor would normally do. Surgical care practitioner mainly does the roles that a surgeon would normally do. So that means doing clinics, meeting patients, planning the treatment, assisting in cases, and sometimes you can also do surgeries yourself under the direct supervision of a surgeon. You can do hernias, you can do carpal tunnels, little cases, and assist in major cases like hips and knee replacements. And apparently you can also close the wound when you're finished with the operation. That's something that a scrub nurse wouldn't normally do. There's a whole lot of other roles and responsibilities a surgical care practitioner would do, and I'm going to put the link to the literature that I found about it in the description box below so you can check it out. So I've looked it up, and apparently this role has been around for some time now, and there's been a lot of talk going on about it, because obviously when you start training scrub nurses and ODPs to become surgical care practitioners, then they will have to leave their old post. You now ended up with less nurses and ODPs in your department. As a scrub nurse myself, I'm really excited to take on a role like that if ever it gets introduced in our department. But obviously there's also you gotta have this worry that maybe a patient wouldn't want me to operate on them, something like that. I'm sure that will happen in the future if I ended up becoming a surgical care practitioner, because obviously some patients would want a doctor to do their operation for them. But apparently the government is doing this because they want to cut the waiting time in emergency departments. If you're thinking about what about the hours of work and how much are you going to get paid if you start doing this new role, apparently it's going to be the same as a normal working hour, which is 37.5 hours, which is what I was talking about in my previous video. And also your pay will be band 7, so it's quite good. From a band 5 or a band 6 you will become a band 7, but obviously your role is going to be quite big once you step up to become a surgical care practitioner. I've been looking it up, and there's a lot of there that really a doctor would normally be doing. So it's like doing clinics, doing ward rounds, prescribing medications, planning treatment with the patient, looking after them when the operation is finished. A lot of things like that I haven't really done before. So I'm hoping that if I do end up doing this surgical care practitioner role, so I would be hoping that the 2-year course that you'll have to take to become a surgical care practitioner would be full of information that should hopefully equip you once you start doing the role, because it's quite a big step from just being a scrub nurse to becoming the surgeon yourself. How about you? What do you think about this new role? Do you think it's something that you would do if you're a scrub nurse here in the UK? Let me know in the comment section below. That's the exciting news this week. If you're new to my channel, please subscribe for more information to come, and check out my older videos as well. If you've got some friends and families who want to work here in the UK as a scrub nurse, hopefully some of my videos will be helpful for them. Thank you for watching. See you next week.